been about a week, and I guess you've done a bit of sightseeing as well. So have you seen the Taj Mahal?
Yes, I saw the Taj Mahal. Actually, I was able to do some sightseeing the day after actually that I had the surgery.
So that's great. So
yeah.
you had a facelift, and
yes. 2
days later you were able to actually go out. And
yes, I was. Yes.
And did you feel safe?
Oh yes, with the taxi driver and Sunil, but I've had plenty of people that were here to help me, and I felt very safe.
And so I guess it's your flight tonight. So do you feel quite comfortable going back?
Yeah.
And are you happy that this has kind of gone well? And
oh yeah, this. As I mentioned before, this was something I wanted to do for a long time, and I never expected the results to be as good as it came out. I mean, I've lost this turkey neck, the jowls are gone, the crow's feet are gone, and it wants to make me smile. When I first saw myself in the mirror, it was like, I am so happy, and I smiled more than I ever have that day, and I hope to keep smiling more because I need to do it. But I owe it really to Dr. Sunil, because you are a master artist in your surgery. I just, very, very, very pleased, and would highly recommend coming to India. And what I've heard is that some of the best doctors are from India.
Yes.
And so that's not just Dr. Sunil, but other doctors here.
Yes.
So.
Well, it's a small world.
Yeah.
And most of us have trained all over the world, and we're back to our own country and giving these services. And one of the concerns that a lot of people have when they travel from overseas, long distances, is about safety and about the quality of care that they're going to get. How do you rate the quality of care that you received here in Max hospital as compared to, say, any other good big hospital or center in the US? And do you think at all stages you felt safe, the way we actually handled the situation, how we actually processed your surgeries, and did you have adequate discussions before you actually came over? And do you think a proper medical protocol was followed? So I think we need to really have your insight, your inside story, your feedback on that, because we pride ourselves in that, because we try and be as safe as possible. We go through the patient's history, we often do teleconferencing, we often go through the pictures, and we take a long time in deciding what patient comes through and what patient doesn't. And I think this is a message that we want to send across, that as far as our center is concerned, we're very careful with selecting our patients, and we try and make it as safe as possible, and we do follow all standard best protocols which are accepted around the world in the medical fraternity. So I just want to have your take on that, as to whether you think it's safe for people to travel all the way.
Oh yes, and there's a lot of questions there, and positive yes to all of them. I think as far as safety, as far as the flight over here, no problem, very, very safe. And the guest houses, where you stay in a guest house, and you're with a driver, you have somebody with you at all times, or you're in a very nice 5-star facility. As far as before, everything was explained before I got here. As far as the hospital itself, I've only been in hospitals in the United States, but I felt the care was better, and I thought there was more care. In fact, when I first got here, there was somebody coming in about every 15-20 minutes wondering if I needed something, and they were right there. And when I wanted some pain medication, it was right on time. And so there was other questions you asked me, but as far as protocol, very much positive. I've got.
So people who would like to come over, what would be your message?
My message would, if you want to save a lot of money on the operation and get really positive even better care maybe than the United States, I think, and also see India and be able to tour, you know, and see a different part of the world, which is very fascinating and diverse. I would say definitely come. I would recommend it.
Well, that's very good. Veronica, it's really nice to
Yeah.
have you as a patient.
Yes. Oh,
I
wonderful
think
to
you're one of
have
the
you.
best patients I've had. So,
You're one of the best little doctors I've ever had. I can certainly say
so
that.
do keep in touch and send us a CD of your songs.
I
Because
will.
we're really interested in how you're actually sing.
I will do that.
We,
Thank you.
I haven't really heard you sing, so I'm very interested anyway.
Okay.
So, okay. So it's the end of doctor-patient relationship, and it's the beginning of a friendship. So